Hola, muy buenos días
Good morning. Welcome to this press briefing organized by the Pan American Health Organization on the COVID-19 pandemic in the region of the Americas this Wednesday, May 12, 2021. My name is Sebastiano Leal with the Communications Department at PAHO, and this session will be about an hour long. We have already received your questions via email, and you will also be able to ask your questions live and also through the chat and the Q&A button. Please do include your name and media outlet when sending your questions. Let me remind you that we have simultaneous interpretation into English, Portuguese, French, and you will be able to choose the language of your choice by selecting interpretation. Today, Dr. Carissa Etienne will be informing on the situation of the pandemic in the region, as well as the situation with the health services and health workers. We have Dr. Jarbas Barbosa joining Dr. Etienne, Jarbas Barbosa, who is Assistant Director, Dr. Ciro Ugarte, Director of Health Emergencies, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19 today. Now, I would like to invite Dr. Carissa Etienne to share her opening remarks. Dr. Etienne, you have the floor.
Good morning, and thank you for joining today's press briefing. In the last week, our region reported more than 1.2 million new COVID cases and nearly 34,000 COVID-related deaths. Nearly 40% of all global deaths reported last week happened right here in the Americas. This is a clear sign that transmission is far from being controlled in our region, even as countries like the United States and Brazil are reporting reductions in cases. In North America, Canada is seeing higher rates of infections than the United States, particularly across Eastern Canada and the Northern Territory, home to a majority Indigenous population. Cuba continues to drive most new infections in the Caribbean, although smaller countries like Trinidad and Tobago are experiencing significant jumps. In St. Vincent and the Grenadines, COVID-19 cases in evacuation shelters continues to be a challenge following the frequent volcanic eruptions. Throughout much of the Americas, we are seeing cases accelerate along national borders. In Central America, jumps in infections are being reported along the regions of Costa Rica and Honduras bordering Nicaragua, and in border regions of Guatemala and El Salvador. In South America, cases are surging in the areas of Guyana and Bolivia that border Brazil, and in Colombia, where COVID-19 cases have been steadily increasing over several weeks. We expect even steeper rises following a week of protests in Colombia. Our health systems are challenged to care for an influx in COVID patients as they scale vaccination efforts. More than 140 million people have been fully vaccinated against COVID in the Americas. The WHO's recent approval of the Sinopharm vaccine offers fresh confidence to countries in the region where the vaccine is already in use and brings hope for expanding access to vaccines in the Americas. But until we have enough vaccines to protect everyone, our health systems and the patients that rely on them remain in danger. Across our region, nearly 80% of our intensive care units are filled with COVID patients, and the numbers are even more dire in some places. In Chile and Peru, 95% of ICU beds are occupied, the majority by COVID patients. Buenos Aires, where 96% of ICU beds are in use, just tightened restrictions to avoid the collapse of hospitals. Some areas in Brazil have waiting lists for ICU beds. The rise in hospitalization has meant that our health workers are working overtime and juggling more responsibilities as they manage more patients now than at any other point in the pandemic. PAHO has helped deploy 26 emergency medical teams across 23 countries in the Americas to provide specialized care where it is most needed. Also, some 400 emergency medical teams at alternative medical care sites were set up, helping our countries expand their capacity with over 14,000 new hospital beds and 1,500 more intensive care beds. But based on how COVID is spreading, we estimate we'll need 20,000 doctors and more than 30,000 nurses to manage the ICU needs of just half of the countries in Latin America and the Caribbean. Our health workers are also facing mounting challenges as the life-saving supplies that they rely on, like oxygen, are running dangerously low. A typical COVID patient can require up to 300,000 liters of oxygen during a 20-day hospital stay. And patients in critical care often need double that. So it is no surprise that the rise in hospitalizations across our region are triggering an unprecedented oxygen supply challenge throughout the Americas. Many countries and local governments have had to quickly develop technical skills and find urgent solutions to provide oxygen for patients. PAHO has been focused on mapping the oxygen supplies across our region to identify where help is more urgently needed. And we created a technical group to provide expertise so countries can make needed investments. To fill critical gaps, PAHO donated more than 7,000 pulse oximeters and nearly 2,000 oxygen concentrators to help health workers identify when a patient needs oxygen and to ensure that they have the supplies to help them recover. We are working hand in hand with ministries of health, particularly in hard-hit places like Bolivia, Antigua and Barbuda, to help countries redesign their models of care and update their clinical guidelines to optimize resource available and ensure that more patients receive the oxygen that they need. We are also helping countries safely scale their oxygen production and to make needed investments in equipment, updates, maintenance, and human resources so oxygen is consistently available everywhere now and into the future. Throughout this pandemic, we have seen what happens when countries deprioritize health systems. Whether it was shortages of PPEs, ICU beds, oxygen, or health workers, countries are being forced to act quickly to make up for years of underinvestment. And while countries have dramatically expanded their healthcare capacity in just a few months' time, our health workers are continuing to feel the strain of this pandemic. While data is limited, we know that at least 1.8 million health workers have become infected with COVID in our region since the start of the pandemic. This is 12% of our estimated health workforce of 15 million, and over 9,000 have died from the virus. And the majority of them have been women and nurses. So as we commemorate today's International Day of the Nurse, let's honor the work, the sacrifice, and the contributions of nurses throughout the Americas who are helping provide life-saving care to COVID patients. Reports from 18 countries in Latin America and the Caribbean show that about 1.5 million health workers are now fully vaccinated against COVID with both doses. But we urge countries to make the most of limited doses by protecting health workers, including the 8.4 million nurses working in our region, and to prioritize them first. And finally, to improve our COVID response and build back better from this pandemic, let's invest in nurses and ensure that they have the tools, the training, and the resources that they need to do their jobs safely. Thanks.
Muchas gracias, doctora
Thank you
Etienne.
very much, Dr. Etienne. Now we will move on to answering the questions that we have received already and that we are still receiving through the Q&A. Please do remember to include your name and media outlet when sending the questions. The first question is by Chris Vilches, who is a journalist with El Comercio, Peru. She's asking, when will the COVAX facility be able to have the Sinopharm doses? In what quantities and what countries will be receiving these vaccines? Dr. Barbosa, thank you very much for the question. We have many vaccines that are being assessed by WHO so that after the assessment, they can be included in the list of vaccines for emergency use. The latest one is the Sinopharm vaccine. It is an excellent piece of news, as Madam Director just underscored. The more vaccines we have authorized for emergency use, the more supply of vaccines we will have for the COVAX facility. There are other vaccines that are still being assessed, and this process oftentimes is not only related to WHO in Geneva, but this is highly dependent on the quality and the information provided by vaccine producers to be able to determine the safety, quality, and efficacy of the vaccines. This is a good piece of news, but we don't know when we will be receiving the first vaccines by Sinopharm for Latin America and the Caribbean, because we are concluding the agreements for those vaccines. At any rate, it's good news. It is another producer, but certainly we won't have those vaccines within a week or a month. So we need to continue using vaccines in a rational fashion for the most vulnerable groups. And PAHO continues to make efforts to find donations for from countries that already have vaccines to cover for their own needs, so that those donations can supplement the vaccines that are offered through COVAX, and countries may have faster access to the vaccines they need. Thank you. Thank you, Doctor. The next questions are related to the variants. Chris Vilches, also with El Comercio, and Melina Ochoa with UNO-TV in Mexico, is asking the following. Chris is asking, what countries in the region have already reported the South African and the Indian variant? Is it possible for them to spread rapidly in all of the countries? And Melina Ochoa is asking whether the Mexican population should be concerned about the circulation of the Indian variant in Mexico, which has been classified as a variant of concern by WHO. And she's asking also whether the COVID-19 vaccines are effective against the Indian variant. Thank you very much. This is Dr. Aldigueri. I'll try to combine the questions and focus my answers. Yesterday, B1617, which is predominant in India, has been confirmed in 6 countries of the region in North America, Central America, and South America, and the Caribbean. As to the variant that was initially detected in South America, that variant has been confirmed in 17 countries throughout the subregions of the Americas. And we already communicated this in earlier press briefings. As to the predominant variant in India, some observations and findings allow us to conclude that it has enhanced capacity to be transmitted, as we have seen with other variants of concerns. Also, as a cautionary principle, that variant of India has been classified as a variant of great concern. However, we should also mention that there is no evidence so far to infer that that variant or other circulating variants may be more aggressive or more lethal. Where has it been detected? It has been detected in some sporadic cases and mainly in travelers. So far, none of those events has led to an increase in the number of cases or the displacement of other variants that had already been circulating in the region. Even though it is eventually possible for some circulating variants in the region of the Americas to start to increase circulation, the control measures as implemented, such as the use of masks, face masks, and also social distancing, all in vaccination now, all of these measures have proven to be or shown to be sufficient to halt the transmission of any variant. Now, as to the specific aspects of the question by Mexico, INDRA in Mexico, as we already commented last week, is leading the National Genomic Surveillance Network that has also detected variants that are circulating in the country, and certainly other variants will be detected. I would like to underscore that Mexico is participating in notifying, reporting in real time to the genomic network, and INDRE is one of the 6 regional labs of reference for genomic surveillance in the region of the Americas. I hope I have addressed the concerns of both media outlets in Peru and Mexico. Thank you. Thank you, Doctor. The next question have to do with Venezuela, and they were sent by Nicole Yapur from Bloomberg, Venezuela, and Mariana Suquet from Efecto Cocuyo. Could PAHO confirm the reception of the second portion of the payment by Venezuela to the COVAX facility? And if received, when is it expected to send the first vaccines to the country, and who's the producer? And also, Mariana is asking, how are the negotiations moving forward, as well as a vaccination schedule? And does PAHO know how many individuals have been vaccinated in Venezuela, or how many doses have been administered in the country? Dr. Ugarte, thank you very much for those questions. They are very important. We have received information from Gavi, that is the financial mechanism within COVAX, indicating that Venezuela has made additional payments towards the outstanding balance. So the balance of funds continues to shrink. That balance used to be $18 million a couple of days ago, and Venezuela would be receiving the vaccines available when it is time to plan the next shipment, and that would be mid-June, late June. So Venezuela would be receiving the vaccines in about those times, and unless there are any delays that we all know could happen. As to the type of vaccine, it has not been determined, but it is likely for them to receive the Johnson& and Johnson vaccine or other vaccines that may be available then. As to the negotiations, I would like to underscore the openness of the Ministry of Health, the opposition, the scientific society, the National Academy of Medicine, as well as other actors to discuss, review the process to finalize the plan and its implementation, and also to include monitoring and also prioritization, etc. All of this is a very complex and long process, and some technical groups have also been participating with additional support. To that end, the plan needs to be discussed. Today, another meeting was held or will be held to discuss this process in greater detail, and we are optimistic as to the release of additional funds, not only for vaccines for COVID-19 for Venezuela, but also for the implementation of vaccination, including logistics, cold chain, monitoring, and review, always based on equality, transparency, solidarity, which are the basis of the discussion that we are holding within the technical table for discussing the issue of the vaccine. Thank you very much. The next questions were sent by Steven Cillian from St. Martin and Douglas from Jamaica Information Services. Stephen is asking in English.
In exports to other countries due to a surge in the COVID-19 virus in India, how is the suspension expected to impact in the region's vaccines rollout? Y Douglas McIntosh dice si en inglés también, if we can please remind of the quantities and timelines for the delivery of Moderna vaccines in the region. Dr. Barbosa.
Thank you. Thank you for these questions. First, of course, that we are concerned about the limitations or the suspension from the government of India to allow the Serum Institute of India to export the vaccines that they are committed with COVAX facility. They have a contract signed, they received the payment, but they are not being allowed to export the vaccine. WTO, Gavi are in negotiation with the government of India, trying to reach an agreement that could allow the government of India to receive a certain amount of vaccine to their use in the national immunization program of India, because of course that this is also a very important public health emergency now in India, but also to at least partially deploy the vaccines to COVAX facility. We haven't heard so far an announcement about the finalization of this agreement, so the suspension still remains. This is concerning because we have only 3 countries in the region that are receiving vaccines from the Serum Institute of India, Bolivia, Nicaragua, and Haiti. But if this problem is not solved, the vaccines that are available will be split among all the countries. So even in the situation that now we have new sites that produce the AstraZeneca vaccine that received the EUL, the authorization for emergency use by WTO. Now we have a producer in China, we have a producer in Spain, and we are expecting another producer in Italy. But even with these new producers, from AstraZeneca, for AstraZeneca vaccine starting deploying vaccine, probably we can face during this month, May and in June, serious problems to guarantee that the estimation, the vaccines that were estimated to be deployed to the countries really get to the country. So this is a concern, and we hope that we can find a good agreement, that all the countries could find a good agreement with Indian government, that the negotiation that WTO is conducting with the government of India can have a good result, and we can count with the vaccines from Serum Institute of India. The second question about the Moderna vaccines, Moderna committed around 500 million doses to COVAX, but only around 46 million this year. So most of the vaccines will be deployed during the first quarter of 2022. Thank you.
Gracias, doctor. Siguientes preguntas son...
Thank you very much, doctor. The next questions are by Rachel Scott from The Guardian in Bahamas, Jacqueline Charles from Miami Herald, and also Jasmine Brown from Bahamas. And in English, the question is,
given the currently dire situation with COVID-19 in the Americas, what are the expert thoughts on tourism-dependent countries loosening travel restrictions for fully vaccinated tourists at this time? Do you advise against it? Jacqueline Charles del Miami Herald también preguntó, how will the resumption of cruising affect the progress that the Caribbean has made? The industry is proposing bringing cruise passengers back, and not all are mandating vaccines for crew and passengers. Dr. Aldigueri?
Thank you, Ms. Charles, Scott, and Brown, I think, for this series of questions. I will try to combine the context and my answers. PAHO is aware of the strain that the pandemic is posing on the tourism industry and on national economies depending on tourism, specifically in the Caribbean. As well as we are aware of the efforts of cruise lines to establish preventive and mitigation measures on board vessels. However, considering the major COVID-19 transmission events that occurred on board cruise ships worldwide at the beginning of the pandemic, it is imperative to act with utmost caution. At present, with the evolution of the spread of the virus across the Americas and in Europe, the unknowns related to the impact of COVID-19 vaccines on the transmission of the virus, and the challenges related to accessing the vaccine and to roll out vaccination campaign in most countries of the regions, we need to act with caution. The WHO position paper published in February 2021 states that proof of vaccination against COVID-19 should neither be regarded as a guarantee of free of infection, nor be required as a condition to undertake an international travel. Also, we have from early May 2021, the US CDC that has published technical instructions for simulated voyages by cruise ship. Such voyages contemplate the participation of volunteer passengers who can be fully, partially, or not vaccinated against COVID-19. The approach of the US CDC is an example of what is needed, one of the examples. establishing more robust normative and regulatory frameworks at national level, countries that would receive passengers and international travelers, and including countries of origin of the cruise ships, also clearly defining responsibilities of the national authorities, the cruise lines operators, and also the passengers. And also, this document flags the importance of covering health insurance aspects and other operational aspects, such as potential repatriations. So this is a complex matter, and I hope that my answers have helped to the colleagues based in Miami and the Caribbean to characterize this complex aspect. Thank you.
Gracias, doctor. La próxima pregunta nos llegó de Anthony.
Thank you, doctor. We have a question from Anthony Esposito from Reuters. In English, it reads,
residents of countries in Latin America traveling to the United States to get vaccinated as vaccination campaigns in their home countries struggle. What can you say about this, Dr. Etienne?
So thanks for this question, Anthony. We don't have the data to confirm how many Latin Americans are traveling to the US to access vaccines. But we have seen reports about US cities considering making vaccines available for tourists. Let me say that vaccine tourism is not the solution, but rather a symptom of how unequally vaccines are being distributed in the Americas. Vaccines can be the difference between life and death and should not be a privilege of wealthy countries or wealthy people, but I dare say a right for all. Those who cannot afford to pay for international travel, which really it's the vast majority of people in our region, they remain without access to vaccines. And that is not acceptable. And that's why we need to get more doses in every country of our region. And to ensure that those doses are fairly distributed, starting with those who are at greatest risk, like our health workers and the elderly and those with pre-existing conditions. So PAHO is committed to this goal, and we are working through all possible avenues to address the barriers that are preventing more vaccines from reaching our region. We are working with COVAX and manufacturers to get more supplies and expedite deliveries of the vaccines that are available. But we are also looking at other strategies, from encouraging donations to boosting regional manufacturing capacity in the Americas. Given the epidemiological burden in our region and the high mortality of COVID in many countries, Latin America and the Caribbean should be a priority for immunizations to help save lives and to prevent future outbreaks. Ultimately, vaccine tourism aggravates inequality. At PAHO, we are working in the opposite direction. We want to bring vaccines to those who need them, regardless of where they live or how much they can afford. And that's the only way that we will all be safe.
Gracias, doctora Etienne. La siguiente pregunta en el...
Thank you, Dr. Etienne. The next question is from Matias Loel, and it's in Spanish. It says, in India, there have been deaths due to lack of oxygen in the hospitals. The director of PAHO is talking about an unprecedented problem in the availability of oxygen. And do we have a similar situation of lack of oxygen in our region? Dr. Ugarte, thank you. This is a very important and current question. Yes, scarcity of oxygen, but also of other medicines and supplies which are used for treating patients in severe or serious conditions in hospitals is a reality, and there's a great need in several countries. And this happens in those places where there has been an increase in the number of cases within a short period of time, and they have saturated the ability to produce oxygen and distribution of oxygen, and therefore there has been an increase in the cost and availability of oxygen for patients. We have been witnesses to long lines that are happening in different countries. And in many cases, we've heard reports that people wait for hours. And in many cases, people even leave the line, have to leave the line they've been waiting on for a long time because they are told that the patient for whom they were waiting the oxygen for has died. So, uh, in the countries where vaccination has been initiated, the population has a false sense of security and safety that things are improving and therefore we should do away with restrictions. But reality proves that this is not at all the case. Right now is when we need to be even more cautious, and the lack of oxygen and the lack of other supplies and deaths of patients due to these quick increases in the number of cases are due to the fact that there is an increase in the probability of transmission of the virus from one person to another. The situation in India is a case in point, but it has also happened in Europe and Latin America, and it is happening in some areas in our region due to the dramatic increase of cases. And these cases, many of them lead to deaths. Thank you. Thank you, doctor. Next question is Manohna Paribatla from Reuters News in English. She asks,
Vaccine production pose a challenge to the supply of other routine vaccines? Dr. Barbosa?
Thank you for this question. PAHO has a revolving fund that has working for more than 40 years now, providing technical cooperation to the countries to guarantee their access to vaccines, to their routine immunization programs. We are, since last year, we are monitoring, following up with the producers, scanning the horizon of the producers. So far, we have not identified any kind of shortage. We have very producers for COVID-19 vaccines that are not traditional producers for vaccines against the polio, measles, and others, but we need to monitor this very carefully. For syringes, we have noticed that there are some limited access. For this reason, the PAHO's revolving fund for vaccine since last year has started the purchasing syringes to provide them to our member states. So we need to follow up, but so far we haven't identified any limitation due to the production. But it is also important to highlight that for the national immunization programs, this is a challenge because they need now to run the immunization program and at the same time to offer the vaccine against COVID-19. The pandemic produced some severe impacts in many public health programs, and immunization is one of them. The data that we collect from the countries are showing that in 2020, we had a reduction in the first semester around 23 to 24% in the number of children vaccinated against measles and other diseases. So it is very important that in every country, we need to review the data very carefully. We need to identify what are the areas, the neighborhoods, the cities that are lagging behind the vaccination, the routine vaccination, and to establish specific strategies to protect the health professionals, to give confidence in the population that they can receive the vaccine without having any risk to get COVID-19 in crowded health centers or in the line. So this is working. Many countries are already recovering the numbers, and we do believe that this will be a challenge that we are supporting the countries to overcome in this year. Thank you.
Gracias, doctor. Siguiente pregunta es de Aldo Vinolin.
Thank you, Dr. Aldo Vinolin. It is related to treatment in English.
Which is proved to be a specific cure for COVID-19, and which drug is the most effective in treating COVID other than remdesivir? Any updates in treating severe cases of COVID-19? Dr. Aldigueri?
Thank you for this question, Mr. Binolan. I'd like to highlight that WHO and PAHO are updating on a regular basis their clinical management guidelines and are totally aligned regarding the medications to be used for treating severe forms of COVID-19. PAHO and WHO are not recommending the use of remdesivir for managing severe forms of COVID-19. And at the moment, no other antiviral is recommended. However, please note that we have randomized clinical trials ongoing for some antivirals and other medications. The set of PAHO recommendations for medications dealing with severe cases of COVID-19 focuses on the inflammatory response to the infection, with a recommendation for using corticosteroids, including the dexamethasone. In some cases, immunomodulators are also recommended. So please note that PAHO updates its guidelines for clinical management and its review of potential therapeutics on a regular basis. For the potential therapeutics, it's minimum once a month. It means that the state of the art of the scientific evidence is available through these documents, and these documents are posted on the PAHO website and accessible for doctors, medical associations, and also the public at large. I hope I have answered the concerns of the journalist. Thank you.
Gracias, doctor. La próxima pregunta es de Noel Miranda.
Thank you, doctor, from Noel Miranda, from Artículo 66 in Nicaragua. And it is how does PAHO assess the work of the government of Nicaragua in caring for the pandemic? And has PAHO followed up the vaccination process in Nicaragua? When will vaccination start for the healthy population? And do you know that you need to be vaccinated in order to leave the country? So, Dr. Ugarte, this question for you. Thank you for your questions, Noel. PAHO coordinates with the government of Nicaragua in implementing the response program to COVID-19. Guidelines and protocols have been developed for response, and also training and technical cooperation have been provided. However, given that the information that we receive is stark, and it comes through the channels of the international health regulations, we cannot really assess the degree of transmission, severity, or other aspects. But so PAHO cannot truly do an assessment regarding the work of the government in response to the pandemic. Regarding the vaccine, Our team in the country office in Nicaragua works very closely with the immunization program, the EPI program in the ministry. We have regular meetings where we see how much progress is has been achieved in vaccination, and some assessments are done, and if adjustments are necessary, they're made. I would like to emphasize that during all these conversations, emphasis is made on the fact that vaccination is a public good and it belongs to the whole of the population. And administration of vaccines should be carried out without any regard uh, 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 to things other than the establishment of priority groups. And so, vaccination priorities are those who have comorbidities, healthcare workers, and people over 55. But given the scarcity of vaccines, as mentioned by Dr. Barbosa, and also as is well known regarding the limitation in production, Nicaragua is one of the countries that has not received the amount of doses as they expected. So we are all hoping that these restrictions will be lifted and that vaccines can be administered to the whole of the population. We have no information regarding the need of having to be vaccinated before leaving the country. This is a discussion that several countries are entering into right now, but to this point, this restriction is not being implemented, and the recommendations both from WHO and PAHO uh, are that vaccination be not a requirement for international travel or transit or resumption of economic activities. Let me repeat that protection measures that have proved to be effective need to be maintained at all levels, and including Nicaragua, where people who are being vaccinated should still keep their protection measures once they have been vaccinated, because as long as we don't have significant numbers of the population vaccinated, and these won't be achieved for a while, then protective measures should be kept. Next question is from Gisela Salomon, Agencia P. One of the questions is, could we give some update regarding vaccine donations from developed countries to Latin America, and if there are companies that have joined the efforts and are also making donations? Dr. Barbosa. Yes, thank you for your question. Donations of vaccines from developed countries seem to be a very important alternative to respond to the limitation of vaccine supply through the COVAX mechanism, which has happened during the first half of the year. For many weeks, negotiations have been started with some governments, and some of these governments requested that these negotiations not be made public up until the time when they can announce officially, in order not to create false hopes. The first government that has already announced was the government of Spain, and the Prime Minister of Spain, during a summit of Ibero-America at the end of April, announced that they will make donations for the COVAX mechanism, and the vaccines should be directed to Latin America and the Caribbean, and PAHO should be the organization in charge of distributing these vaccines that are donated. So we have met many times with government officials from Spain, and they are aware of the capacity of our revolving fund to make quick distributions of vaccines. There are other negotiations. Our director has sent a letter to the government of the United States requesting that at least those vaccines that are not being used in the United States may be donated. And we are still waiting to hear from the US government, and we are in conversations with other countries as well. Those vaccines from Spain are still pending in terms of knowing the date of arrival or the amount. But this is a good initiative, which perhaps could set the example set so that other developed countries can make donations so that access of Latin American and Caribbean countries can become a priority. We know that this region is one of the epicenters. We know that India is also now an epicenter, but uh, Latin America and the Caribbean have been severely affected by the pandemic. And if um, we are going to distribute just based on population, uh, Latin America is at a disadvantage because we have a very limited amount of vaccines for Latin America and the Caribbean if we go only by population. Other countries, Sweden uh, and others, have announced. And this should be a global appeal so that the leaders of the developed world begin to make immediate donations to broaden the capacity to vaccinate the most vulnerable groups and save lives in our region. Thank you very much. Thank you, Doctor. Next question is from Kevin Telmine from the Guardian Media in Trinidad and Tobago in English.
Tobago is going through a rapid increase in COVID 19 spread and deaths. In countries that are politically charged, there is no unifying message regarding the fight against COVID 19. Does PAHO view this as an impediment in countries' fight against COVID 19? What is PAHO's recommendations on how state officials and agencies can communicate to convince a skeptical population to play their part in combating the virus? Dr. Ugarte?
Okay. Uh, the issue of information is a critical aspect, and we have seen, unfortunately, that uh, there have been misuse for political purposes or other purposes. We have been seeing that infodemics have caused more harm than even not implementing protective measures. In that regard, we have been suggesting and working with all the governments and all the partners to lead by example, to look at the source, to make their comments and their messages based on evidence. And of course, always look for a reliable source to provide information. And we have been looking also for the reports, for the official reports to be absolutely transparent and easily available, and also to use other media, like social media, for example, to disseminate appropriate, updated information so the population, general population, can reach that information. We have seen that social media is one of the main sources of information for the general population, at the same time that the official reports and the main recommendations are not being used in those channels, but through communication media or official websites, etc. And of course, that does not reach the entire population. So in that regard, this is a call for all actors to provide accurate information, but easily understandable for the entire population so the population can continue implementing the protective measures. That is the core to reduce transmission, to reduce the deaths, and to overcome this pandemic together. Thank you.
Gracias, doctor. Estamos llegando ya al final de esta sesión.
Thank you, Doctor. We're coming to the end of this session today. The next question is related to the herd immunity and COVID-19. Rachel Court from Nassau Guardian, another journalist, asked in English,
immunity in the region, and what does it mean for the relaxation of measures? Dr. Etienne?
Thank you for this important question and very topical. Um, there is still much that we don't know about this virus, including its threshold for herd immunity. Would it be 70, 80, 90%? We don't know. And this is especially as several different vaccines are in use. We will likely have a better picture once more real life data from countries that achieve high immunization coverage when that data becomes available. But importantly, I think we must also keep in mind that the emergence of variants makes herd immunity much more complicated. And so that's why throughout the region, we need to focus on reducing transmission to control the number of new infections. And this should be our absolute priority. We can only do this by implementing two strategies in combination. Let me stress in combination. The first is to implement preventive measures. And we've said this many, many times, but we need to say it again. Persons need to observe social distancing, the wearing of masks, the washing of hands frequently, and the avoidance of crowded spaces. This has saved countless lives, and it will continue to do so as long as the virus is circulating. But governments as well. Governments have a role to play. We need to ensure that testing is still widely available, that those who test positive are isolated, that we quarantine, and that we continue to observe some of the measures that governments have taken. Importantly as well, we think that governments should continue to incentivize these behaviors that they want nationals to follow. The second is to expand equitable access to vaccines. While we know that doses are limited, we must first protect our health workers and those that are most vulnerable to COVID-19. As more doses arrive, we will start to see their impact on transmission. When one person is vaccinated, they reduce their own risk of getting sick, but as well the risk to their community. And so that's why it's critical that we all get vaccinated when it's our turn. We should not delay because waiting to get vaccinated prolongs this crisis. These two strategies need to happen simultaneously. As we ramp up vaccinations, it is also important to control the virus's spread through the public health measures other than vaccines. The countries that have ignored public health measures have seen spikes in cases, even after a significant part of their population has been vaccinated. So let's remember that it is the combination of the two approaches, public health measures and vaccines, that will eventually control COVID-19. So each of us has an important role to play. So please do your part. Thanks.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. And now this is the end of our session today. We have an announcement about tomorrow. You will have received information from our email that tomorrow, Thursday at 3 o'clock, Washington, D.C., there will be a virtual seminar for journalists on the variants of COVID-19. This is a collaboration with Fiocruz and PAHO, and you can also always find information on the pandemic in our website, www.paho.org. Thank you for connecting, and that's it for today.